Welcome to aminacademy.com in human anatomy and physiology regarding the cardiovascular system. Let us discuss about blood circulation in the upper limb. Arterial supply, the subclavian arteries. The right subclavian artery arises from the brachiocephalic artery. The left branches from the arch of the aorta. They are slightly arched and pass behind the clavicles and over the first ribs before entering the axilla. Before entering axilla, each subclavian artery gives off two branches. The vertebral artery, which passes upward to supply the brain, and the internal thoracic artery, which supplies the breast and a number of structures in the thoracic cavity. The axillary artery is a continuation of the subclavian artery and lies in the axilla. The first part lies deeply, then it runs more superficially to becomes a brachial artery. The brachial artery is a continuation of the axillary artery. It runs down the medial aspect of the upper arm, passes to the front of the elbow, and extends to about 1 centimeter below the joint, where it divides into two radial and ulnar arteries. The radial artery passes down the radial or lateral side of the forearm to the wrist. Just above the wrist, it lies superficially and can be felt in front of the radius as the radial pulse. The artery then passes between the first and second metacarpal bones and enters the palm of the hand. The ulnar artery runs downwards on the ulnar or medial aspect of the forearm to cross the wrist and pass into the hand. There are anastomosis between the radial and ulnar arteries called the deep and superficial palmar arches, from which palmar metacarpal and palmar digital arteries arise to supply the structure in the hand and fingers. Venous return. What is that? The upper limb is drained by both deep and superficial veins. The deep veins follow the course of the arteries and have the same names: palmar metacarpal veins, deep palmar venous arch, ulnar and radial veins, brachial vein, axillary vein, subclavian veins. What is venous return? The most of the venous blood from the organs in the thoracic cavity is drained into the azygos vein and the hemozygous vein. Some of the main veins that join them are the bronchial, esophageal, and intercostal veins. The azygos vein joins the superior vena cava, and the hemozygous vein joins the left brachiocephalic veins. At the distal end of the esophagus, some esophageal veins join the azygos vein and others the left gastric vein. The venous plexus is formed by anastomosis between the veins joins the azygos vein and those joining the left gastric veins, linking the general and portal circulation. Now we'll discuss further detail about blood circulation in the upper limb. This is the blood circulation in the upper limb. Look at here. Blood circulation in the upper limb involves arteries carrying oxygenated blood from the heart and veins returning deoxygenated blood. The main arteries supply the upper limb are the subclavian, axillary, brachial, radial, and ulnar arteries. Veins drain the upper limb through superficial and deep venous system, returning blood to the heart. Arterial supply, subclavian artery. The main artery supplying the upper limb or originating from the brachiocephalic trunk on the right and aortic arch on the left. Axillary artery. The subclavian artery becomes the axillary artery as it enters the arm. Brachial artery. The axillary artery becomes the brachial artery as it continues down the arm. Radial and ulnar arteries. The brachial artery bifurcates into the radial and ulnar arteries in the forearm, supplying the forearm and hand. Venous drainage. Superficial veins. Cephalic vein drains the lateral aspect of the upper limb and enters the axillary vein. Basilic vein drains the medial aspects of the upper limb and also enters the axillary vein. Median cubital veins connects the cephalic and basilic veins in the cubital fossa. Deep veins accompany the corresponding arteries and drains into subclavian vein via the axillary vein. Axillary vein receives the blood from the cephalic, basilic, and brachial veins and continues as the subclavian vein. Subclavian vein drains into the brachiocephalic vein, which then merges with the opposite brachiocephalic vein to form the superior vena cava. So far, we discussed little about blood circulation in the upper limb. We have done. Please subscribe our YouTube channel.